The lectures are based on the chapters in your textbook, Public Health Science and Nursing Practice. The lectures are somewhat scripted so that closed caption can be facilitated for those students who require expanded access to the materials. This presentation is an overview of injury and its impact on public health. Injury is a serious public health issue, kills more than 5 million people globally every year, and harms many more. It's a significant impact on mortality, disability, healthcare costs, and the need for emergency care. When we refer to injury, the types of injuries include motor vehicle crashes, or MVC, drowning, poisoning, falls, burns, assault, self-inflicted violence, and acts of war. Here we see the costs in terms of combined medical and work costs by sex and intent in the U.S., and this data is from 2005. The total number of deaths for females was 10,491 and 40,682 for males. Injury affects more than just the injured person. It affects family, friends, coworkers, employers, and communities as well. To further categorize injuries, there are unintentional, in which there's no predetermined intent to injure another or oneself. It's not referred to as accidents, since they are, for the most part, not due to random, unavoidable events. They are predictable and preventable. Examples of unintentional injuries would be drownings, burns, and or falls. Intentional injuries are deliberate acts that cause harm to either the self or to others. Violence is a broader term used in conjunction with intentional injuries. Physical force used on self or others to violate, damage, or abuse. Violence is a threat to communities and often occurs in conjunction with mental health disorders and substance abuse. $47.2 billion is used annually for direct healthcare costs and loss of work due to violence. Self-inflicted violence refers to suicide. Suicide is what we likely think of when we think of self-inflicted violence. Interpersonal violence is between two individuals and includes two different contexts in which the violence occurs. That can be family, and examples of that would be intimate partner violence, child abuse or maltreatment, and elder abuse. Community violence occurs in the context of the community. An example is stranger violence, where the individuals don't know one another, so it's random, or acquaintance violence, in which they do actually know each other. Collective violence are when groups engage in types of violence, nations, communities, or gangs, so such as terrorism or wars. Violent acts can be neglect, psychological, physical, or sexual in nature. Healthy People 2020, violence and violent acts are a priority issue that affects the community, so it is addressed thoroughly in Healthy People 2020. Prevention of injury and violence, surveillance of injury and violence are all priorities, as well as the CDC's tracking of intentional injuries that began in 2002. So data sources for injury or for violence, is the CDC, police reports, death certificates, and autopsy reports. Risk factors for injury and violence are based on the type of injury, behavioral factors, environmental factors, and socioeconomic factors. This is how we categorize and assess for risk factors. Haddon's matrix is a method used to determine injury risk. Development was based on the epidemiological triangle, which incorporates the three constructs of the triangle: agent, host, and environment. And this was the first non-disease use for this kind of surveillance, and it was for traffic safety. Here's an example of a Haddon's matrix. And it's an analysis of an actual motor vehicle crash. And you can see how the data is filled in the matrix and how it's collected. This is also in your textbook. Prevention of injury and violence is a major public health initiative, and the CDC has a National Center for Injury Prevention. It again conducts surveillance, collects data, and funds research on prevention. Nurse's role. What is your role in all of this? Well, the care provided to the victims, interventions, policies, educating policy makers and the community, and roles in the local, state, national, and international levels. The epidemiology of unintentional injuries consists of looking at risk factors and prevention or preventative measures. Taking as an example for poisonings, there are intentional poisonings and unintentional poisonings, and we're going to talk about unintentional poisonings. Men are 2 times more likely to die as women due to an unintentional poisoning, and the highest mortality is in the age group of 45 to 49. 76% of unintentional poisonings in the U.S. are caused by excessive use of drugs or chemicals for non-medical purposes. So this has been widely impacted by the opiate epidemic. Prevention of unintentional overdosings or poisonings would consist of proper labeling of medications, not sharing medications, and proper disposal of medications. So that would be an example of preventative measures. In the textbook, page 279, table 12.1 outlines 6 goals and select strategies of a national plan for childhood injury prevention. That's really kind of helpful to look at. So moving into falls, a risk factor would be children on the playground. Prevention would be safety measures implemented on the playground, such as a softer surface for them to fall on, and maybe getting rid of equipment that is unsafe or we see a lot of injuries on. Fire-related would be a risk factor to consider is women and children who are in lower income settings. Their risk factor is that they are spending more time at home. They are more likely to cook with an open flame and have fires. Preventative measures would be environmental measures such as a smoke detector. Drownings, a risk factor would be inability to swim. And we seem to see a higher incidence in rural residents. Prevention would be teaching people to swim or mandating supervised swimming areas. Okay. Self-directed violence. Self-directed violence risk factors include underlying mental health disorders. So when we're looking at suicide prevention, strategies that have demonstrated effectiveness are educating healthcare providers on recognizing underlying mental health issues, and also another successful prevention measure has been to restrict access to lethal means, so making firearms unavailable to teenagers, or locked up, or something of that nature. Family violence is a little more complex and requires a thorough assessment. It is at the Community level as well as a family problem. So intimate partner violence and child maltreatment would be included under family violence. Risk factors tend to be lower socioeconomic status and living in an impoverished community. Prevention of child maltreatment, an example of that is the home visitation program, along with teaching nurturing parenting skills. These initiatives have been effective in decreasing the incidence of child maltreatment. This is a topology of violence, and although I don't find it particularly helpful, you may. Community violence has its own unique risk factors. Some facts about community violence are young people tend to perpetuate violent acts at a higher rate than any other age group. Risks for youth violence include low socioeconomic levels, poor parental supervision, delinquent peers, living in a city, and exposure to violence. Protective factors, youth violence, promoting youth development based on a social connectedness is a protective factor. It's inversely associated with the rates of crime at a community level. So in other words, if the youth feel invested in part of the community, they are less likely to, you're less likely to see them act out with violence and crime. Collective violence, again, the risk factors are kind of what we just talked about with community violence in gang fights and family fights and wars in between groups. And prevention seems to be people who are invested in their community. They are less likely to participate in collective violence. So that concludes the presentation of the material, and now we'll move on to a couple of clicker check or questions related to the content that was just presented. Unintentional injury is another term for accidental injury. Is the source of the source of millions of emergency department visits annually? C is characteristic of suicide, or D is characteristic of child maltreatment? And the answer is B. Accidental injuries are predictable and preventable. Suicide is causing self-harm, and child maltreatment is an intentional injury. So B is the correct answer. And if you need a refresher, it's the source of millions of emergency department visits annually. The next question. In the public health spectrum, violence is viewed as A, not really a concern for public health, but is a concern for law enforcement. B, playing a minor role in the health of a community. C is strongly connected with mental health disorders and substance use, or D, a low priority since it is not specifically addressed in Healthy People 2020. The answer is C. Violence and violent acts are addressed by Healthy People 2020, as we saw earlier in the presentation. It's one of the priority issues that affects the health of any community. It is the responsibility of each community to act and resolve the problem of violence, which is strongly associated with substance abuse and mental health maladies. So that concludes our lecture. Thank you for your participation. This is an overview of the risk factors and preventative measures for injuries and violence, and more details are available in your textbook. For questions, you can email me at takoch@lcsc.edu.